Coffee is a popular drink in modern times. Undeniably the taste and benefits that this drink brings. However, it has a different role and influence on patients with diabetes. Many people have the question that is it okay for diabetics to drink coffee? In addition to the uses such as helping the mind awake and spiritually refreshed, there is information that drinking coffee will reduce diabetes. However, is this information really true or not? Please join us to find out the answer. Type 2 diabetes causes symptoms, including excessive thirst and hunger, fatigue, frequent urination, weight loss, blurred vision. This causes blood sugar to rise higher than normal and can easily lead to serious complications, if left untreated or not well controlled. For a healthy person, drinking 1 to 2 cups of coffee daily has many benefits such as reduced risk of stroke, weight loss, reduced risk of type 2 diabetes. Dr. James Lane, psychologist at Duke, who led the study, followed 10 patients with type 2 diabetes, who all drink at least 2 cups of coffee a day but always try to control their disease with diet, exercise, and medication. A 2012 study UK found that drinking 2 to 3 cups of coffee, each from 45 to 50 milliliters each day helps to reduce the risk of diabetes. Additionally, a 2009 study with 40,000 U.S. participants found that drinking 3 cups of tea or coffee per day reduced the risk of type 2 diabetes by 40%. However, drinking more than 4 cups of coffee each the day will increase your blood pressure. Furthermore, it should also be noted that coffee or tea should not be used as the body's primary source of liquid consumption. But for diabetics, drinking coffee is not beneficial. Why? How coffee affect to blood sugar? According to the research results of scientists at Duke University Medical Center, each patient will be closely monitored blood glucose level continuously for 72 hours. The researchers found that when patients drank caffeinated beverages, their blood sugar increased by 8%. Caffeine also increased post-meal glucose rapidly, namely a 9% increase after breakfast, 15% after lunch, and 26% after dinner. Coffee usually not only does not lower blood glucose, but also has the risk of increasing the blood glucose stimulation after eating. Because coffee often contains caffeine. Although caffeine helps people enjoy mental excitement, clarity and reduce stress and fatigue, if people with diabetes drink coffee, we're not sure caffeine raises blood sugar levels, but we have 2 theories. One is that caffeine interferes with the transfer of glucose from the blood to the muscle system and cells in the body. Secondly, caffeine also stimulates the production of adrenaline, a hormone that contributes to hyperglycemia, Dr. Lane said. The above research results were published in the journal Diabetes Care with the conclusion, quitting coffee is a good way to control blood sugar. This is bad news for people with type 2 diabetes who are addicted to coffee. However, to date there are no guidelines to advise patients with type 2 diabetes should quit coffee or not. In fact, everyday medical examination, there are many type 2 diabetic patients who drink coffee, not only in men but also in women. In our opinion, for patients with well-controlled diabetes can drink coffee in a moderate amount every day. And for diabetic patients with difficult to control blood sugar levels, it is beneficial to stop drinking coffee. What to drink to lower blood sugar and some notes when drinking coffee. According to ASIC, Professor Dr. Lane, instead of drinking coffee, people with diabetes should drink tea. Because the water contains a high polyphenol content, inhibitory effect, does not increase blood glucose after eating. Therefore, patients with high blood sugar should drink a glass of solid tap water before meals. In addition, green tea, bitter melon, are also a good drink for people who want to treat diabetes. People with type 2 diabetes who still want to drink coffee can drink decaffeinated coffee, unsweetened coffee, add sugar substitutes such as Splenda, stevia, monk fruit, to control blood sugar. Do not drink coffee with milk. Coffee mixed with condensed milk, it will increase blood sugar. If people with diabetes have trouble sleeping should limit this drink because caffeine affects the central nervous system, it will make it harder to sleep and fatigue, it will create a feeling of excitement affecting motor function, acting on skeletal muscle, making tired feeling worse. If you have type 2 diabetes or are at risk of it, You should focus on making healthier lifestyle choices, such as eating a balanced diet that includes fresh fruits, vegetables, whole grains, and healthy fasts, exercise and lose weight. If people with diabetes have diseases related to the nervous system and heart, you should also limit drinking this drink because they can adversely affect your medical condition. For well-controlled diabetic patients, oral dose of 1 to 2 times per day is most suitable. And diabetic patients whose blood sugar is difficult to control should stop drinking coffee.